Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is what you need to know about occipital nerve blocks. An occipital nerve block is an injection of numbing medicine next to the occipital nerves. They are located on either side of the scalp, originating at the neck. You can see that they come up here. There is a greater and a lesser occipital nerve, and either of those can produce pain, but neither has a motor function. They're only sensory. The injection is designed to stop the pain traveling along these nerves, which can lead to occipital neuralgia, cervicogenic headaches, or migraines. They serve both a diagnostic and a therapeutic purpose. The symptoms of occipital neuralgia may include pain in one or both sides of the head, a tenderness to the scalp, an aching, burning, or a throbbing pain, and it may be described as a sharp or electrical shock in the back part of the head and neck. Who benefits? Occipital neuralgia patients, those with pain on one side of the back of the head, benefit the most. Those with migraines, cervicogenic headaches actually means any headache caused by a problem in the neck, and it's typically one-sided. Cluster headaches are one of the most painful headache types, and those can receive benefit as well. How is it performed? It's a quick procedure. It just takes a few minutes. It can be done in the office. It doesn't need to be done, in a surgery center or with sedation. The pain doctor will feel the point of maximal tenderness at the base of the skull, and then the doctor will move the needle to inject both nerve areas with numbing medicine and possibly some steroid. So you want to get both the greater and the lesser occipital nerve areas for relief, okay? And it can be unilateral, one side, or bilateral, depending on the type of headaches the person's having and where the symptoms are. How well do occipital blocks work? They work amazingly well for such a quick, low-risk procedure. Most patients get pain relief within just a few minutes. For cervicogenic headaches, it's a 50 to 90% response rate, averaging 2.5 months. Cluster headaches is an 85% response rate, which ranges from 1 to 4 months. For occipital neuralgia, it's an 85% response rate for up to 2 months. And then for migraines, it's a 60% response rate, usually averaging 4 to 5 weeks. Well, what's next if the pain relief wears off? You can repeat the procedure, any number of times. You can use a pulsed or a regular radiofrequency ablation. A radiofrequency ablation is a procedure that provides heat, thermal energy to the area to deaden or partially deaden the occipital nerve, okay? Now, people might say, oh, you don't want to deaden the nerve. Well, it's sensory. It's not motor, so it's not like you're going to lose motion. So yeah, people do that a lot. Sometimes it gets pulsed so that it just relieves the pain that way. There are really no large studies available, but small ones show that it works very well. Remember, this is a very low-risk procedure. You're not around the spinal cord or a nerve root. This is just a sensory nerve. Are there risks? Very minimal. There might be some slight bleeding, possibility for an infection or allergic reaction. These are not motor nerves. There's no risk of a CSF leak, cerebrospinal fluid, or spinal cord injury because you're not even in the spinal canal. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics participating throughout the state, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. For the Tampa area, visit us online today at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.